Hey everybody, welcome back to Staying Connected. This is Katie Wright, your host, and today I have Brooke with me. Hey Brooke.
Hi, Katie.
Hey, so how old are you, first off?
I'm 53. I'll be turning 54 in just a little over a month.
Wow, happy early birthday.
Well, thank you. Yeah.
And when were you diagnosed with Vascular Ehlers Danlos Syndrome?
Well, it was in 2007, so it was about a little over 11 years ago. But it's been kind of a lifelong journey of trying to figure out what's been going on with, my body. I had a lot of extremity injuries, over the years. I can remember clear back to, being 7 years old and, injuring my, knee and having it, fill up with fluid and not being able to bend it for quite a while. And I remember after I was diagnosed, my mom said, she goes, I always thought you just, you know, were accident prone or, you know, or you like being injured or something. I don't know what it was, but it was really, and, because I've had so many joint injuries, I've had 7 dislocated shoulders. I kind of lost count on how many times my knee is either dislocated or just kind of I don't know if disintegrated, but blown up and swollen, and my ankles. Where I had an event at work. We decided to have a bowling night, and I ended up dislocating my elbow bowling, and it wasn't from any injury. It was just my youngest son said, "Hey, Dad, why don't you do a granny style bowl?" And so I rolled it like that, and my elbow dislocated.
Ouch.
And so it was, all of these, unusual injuries, that would happen. And, there wasn't really any sort of a marker of, what was going on. But, for me, I was 25 years old and in, really good health. I was, running a lot, swimming, and I ended up, being out in the woods with some friends and got struck in the neck and by nothing really big, and I ended up developing a headache and ended up after stopping driving. I that uh, my right arm was kind of moving really oddly. Didn't really have control over it.
Mm-hmm.
And a friend said, Brooke, are you okay? And when I went to turn around, I ended up falling to the ground, and there's a long me back into the city, but I didn't have use of my right leg, my arm. I didn't know I couldn't open my right eye until the doctor opened my eye and shined the light in, and unfortunately, the neurologist that was on call in the hospital had a patient come in the week prior that had very similar symptoms, that had a dissected carotid artery. So one of the first tests they did is they did a CAT scan and identified that I had a dissected carotid artery. And so they put me on blood thinners, and I was in the hospital for 11 days, and I did an angiogram, and they identified that I had the blockage in the carotid, and had noticed that I had what was called tortuous a carotid artery. Basically, it was kind of like a twisty, like a water slide,
Like one of
and
the really fun ones that goes around in a circle,
yeah, kind of,
like a
yeah,
spiral.
except not a really a good one to have. So anyway, and there was just kind of a slight conversation of, well, that's kind of a symptom of having Ehlers-Danlos type 4, but you don't look like you have it. You have, there's your skin isn't stretchy, or um, a lot of different symptoms they went through. It just you just don't look like you have it, and so that was kind of the last time it was ever brought up for a number of years, and so I was released from the hospital. Everything was fine, but they're like, well, don't lift anything very heavy, and it was challenging because being 25 years old and strong and active and everything, to go to doing nothing was really challenging.
And they wanted you to do that
Um,
because of the dissected artery?
yes,
Okay.
they wanted that to heal, and then they had me on blood thinners, and I ended up having reaction to the blood thinners where my kidneys were bleeding, and so we went through all sorts of pro time tests, and for the next year I kept um, bleeding a lot. My dad asked me to help him move some astroturf, and when I grabbed the one corner of it, I ended up breaking so many veins in my forearm that it turned my from my elbow to my wrist, turned black and blue just by grabbing and pulling on something.
Wow.
And so then I started going back to the doctors to try to figure out, well, why is this happening? And they're like, well, maybe you should cut down on the aspirin that they had me taking. So I did that, and then they started doing these little cuts on my arm to test to see how long it would take for my blood to clot, and that after 30 minutes they would go, yeah, this is it should clot before then, and and so was referred to doctors up in Portland, and had to travel 100 miles or so to go see them, and nothing was ever figured out, and then there was another mention of, well, you may have this, but it was never recommended that I take the test because it was like, well, you just have no visual um, tells that this is what you have, and so it, everything was kind of going fine, life, events, work, ended up getting married, had a couple of kids, and then I was working on our property, and I ended up when I went to move a stump, I grabbed it and went to toss it. I ended up poking myself with a stump or a root, and I thought, well, that was kind of not very smart, and it hurt a little bit, but nothing significant. So I thought, well, I'll just go ahead and ice it for a little while and get back to work. And so I did that, and when I sat up on the couch, I felt this burst in my abdomen, um, and I kind of looked down, and I saw this I don't know. We talked a little bit about Alien, the movie Alien, and it was like this knot was starting to protrude from my, kind of to the left of my, navel, and it was just like it was, forcing its way out, and it was about
Oh,
the size of my fist, and it was like, oh my gosh, and so.
that sounds so creepy. I can't imagine like looking down and seeing that.
Oh yeah, and so I was the only one home, and so I get in my truck, and I'm starting to drive out a road. And fortunately, my wife and kids were coming back in, so I get out of my truck and pile in, and I said, we need to get to the hospital. So she's driving, and she sees this knot sticking out as well, and and I'm trying to keep it covered, and because my kids are in the seat behind, and anyway, and so I go into the hospital, and they see this, and they're just scrambling because they've never seen anything like this before.
Yeah.
And um, and I ended up bleeding out about 25% of my blood volume in about 10 minutes. And uh,
Internally? Or was it
it was
coming out?
it was internally. It was outside the abdominal wall, but under the skin. And so it was, you had this knot about the size of a football protruding out of your stomach area.
Wow.
And, you know, the doctor, my primary physician, to this day, he says, I've never seen anything that big, which is, I guess, I don't know if that's an honor, but I'm thinking not. Um,
How old were you at
and,
this point?
um, Gosh, that was 2001 or two. So I was 30, was it 38?
This was still a few years
Yeah.
before you were
Yeah,
diagnosed.
38. Yeah, that was before I was diagnosed. I was 38 at the time. And no one, the only thought was that, well, I was taking an 81 milligrams of aspirin every day, and so they thought, well, your blood was thinner. That's why you had such significant bleeding, and so and to give you kind of an idea, is I couldn't. My waist was 4 inches larger when when I left the hospital than before I started bleeding. So that's kind of how much my fluid I had. And it was so tender. When I ended up having, I call them my maternity pants, these Columbia pants that didn't put any pressure on, that I could wear I had to do that for like 6 months before I could wear my clothes again, my normal work clothes again. And anyway, and so that went away. Everything was good, and I ended up later cracking a tooth, and ended up having to have a root canal, and everything went okay as far as through most of the procedure. The guy gave me significant amounts of the Novocaine, which has epinephrine in there, which affects your blood pressure. And we're just nearly done with everything. The doctor and the nurse, had left the room, and I ended up, getting this incredibly intense pain in kind of my upper region of my back, and I've had all sorts of different the joint injuries, the hemorrhaging in my abdomen, and this is the first time that I've had pain so intense that I started to black out. And so I lowered my head and kept me from blacking out, and the doctor came back in and asked me what was going on, and I told him that I was having some severe back pain. And so they put some ice on it, and the pain went away. So I ended up going back to driving back to work, and finishing the day out, and went to one of my kids' after school activities, and the pain started coming back, and it after like 45 minutes or an hour of this, we tried to go home, and decided that we better go to the emergency room. And so when I get there, tell them what's going on, and they could see that my back was spasming, and so they're like, well, you must have injured your back somehow. So they just gave me some muscle relaxant, and the spasming stopped, and so I went home, and everything was fine, and they did say that I should go to a chiropractor. So I went to a chiropractor that was a friend, and told him, described what had happened, and he says, if this ever happens again, you call me and come right over. He says, I'll get you taken care of. So exactly a week later, the pain came back, and I called him, and he said, yeah, come on over. So I got there, and he tried to get me on the table, but that wasn't working out very well because of the extreme pain. And he ended up trying to adjust me and standing up, and anyway, and through all of his efforts, he said, this isn't your back. He says, there's something else going on. And so he said that, head over to the hospital. And fortunately, our town is small, so it only takes a few minutes to get anywhere. So I drove back over to the emergency room, and at that time it was difficult to breathe, and looking back, thinking, oh, I'm driving around town and I'm having a hard time breathing. Probably wasn't the best thing for me to do, but I get there and I tell them what's going on, and they ask if they had taken an X-ray the week prior.
Mm-hmm.
And I said no. So they took an X-ray and they came back and said that there's this large mass on your right lung that we have no idea what it is. And they said that we'll need to admit you, and we'll do this procedure. Well, we'll go and put a needle into your pleura and drain out the fluid, and we'll figure out what's going on.
Mm-hmm.
And so they drained out like 720 cc's of fluid and tested it, and everything was fine. And so they're just like, we have no idea what caused that. Mm-hmm. So they referred me over to a pulmonologist over in Eugene, which is about 70 miles away.
And a pulmonologist is like a lung doctor?
Yes.
Okay.
And physician, he goes, people refer me patients when they have no idea what's going on. And he says, and usually they, figure out, I'm able to figure it out. He says, but I don't really have any idea. He says, the best thing I can do is refer you to Stanford University. They have a kind of a Marfan's clinic down there, and they'll take a look at you and figure out what's going on. And I forgot to mention, when I had the lung tests, they did a CAT scan, and they had found 5 aneurysms on different parts of my body. And,
oh, wow.
And that was kind of a trigger of, there's some sort of vascular issue going on. And so we sent those tests down to Stanford. I went down there. They looked at everything, and did all of the normal, measurements and poking and prodding and pulling and everything. And it's just like, we don't think you have vascular Ehlers Danlos, but let's do this blood test just to be sure. He says, we're like 97% sure that you don't have it.
Oh, man. So this is like the third time that this had come up, right?
Yes.
Okay, because it seems like when you're 25 and then 38 or so.
Yes.
And then again when this happened, how old were you?
This was in 2007, and
okay.
So I was 43. And so they did, at that time, they had me come back, and we did a full CAT scan. They did like from the torso and head, and then down, through my legs, and just to get kind of a baseline of what kind of aneurysms that I had, and cover everything. And they did the blood test, and it was fortunately sent up to the University of Washington, and it was when I first got to see a letter drafted by Dr. Peter Byers, and they were able to identify that I had vascular Ehlers Danlos. It was a collagen 3A1 mutation, and at that time it was didn't really mean a lot, but that I had some connective tissue challenge, and but then the doctors from Stanford we're looking at all of the results, and at my final visit there, they told me that you need to go home and basically, get your final whatever in order, basically that I was, not going to survive, and that, I wasn't going to make it basically to my 44th birthday, and that was in 3 months. and they said, well, what we can do is, because I've got a aneurysm on my renal artery, and that's part of what's causing the hypertension and blood thinners, that we need to kill that kidney, and hopefully that'll lower your blood pressure, and then they had all of these other recommendations, and fortunately I had this doctor in Eugene, the pulmonologist, that was more practical, and he's like, well, before through discussions, it's like, well, before we do go to that extreme, let's make sure test to see if the kidney's working it or not, because we don't want to just go ahead and pinch off the blood flow to the kidney, and because he might need it, and then we can treat the blood pressure with lots of different types of prescriptions. And so we went through doing the beta blockers and the calcium blockers, and all of these different types of blood thinners, and so, or not blood thinners, excuse me, blood pressure medications. And so we got a good, as I call, a cocktail of prescriptions together, and I've been able to maintain my blood pressure, and so I really haven't had a lot of challenges, at least I thought. Yes. And then we keep getting older, and because of the limitations that they place on you, recommendations, if you want to have a long life, is don't lift things, don't be under stress, and so then as you're not doing anything, you kind of get into worse and worse physical shape.
Yeah.
And so I thought, well, this was 3 years ago, so in 2015. I was 51 years old. I thought, well, I should start, working on my core a little bit, and so I don't get to be too terrible condition. And so I did 20 crunches. I thought, well, I'll just start light and see how that goes. And the work day went fine. Went to bed, and at about 4 o'clock in the morning, I remember rolling over in bed, and I feel this burst in my abdomen again.
Oh no.
And I'm like, so I get up, and I'm trying to figure out if this is really what I'm thinking it is, and because you can feel, it's really weird how you can feel yourself bleeding internally. And so my wife gets up and asks me what's going on, and tell her. So we go into the emergency room, and our emergency room, isn't really, handled or set up for handling, special cases so much. And I go in there, and fortunately, I had a nurse that was just, he was just willing to listen. There wasn't a doctor available. And so I, told them, what I needed, and they did that. And, they admitted me into the hospital, and were thinking that they needed to transfer me over to Eugene. And I said, well, potentially the bleeding will stop, and so they just put me under kind of a compressed wrap to put pressure on everything. And eventually the bleeding stopped. And, and again, it was about the same situation where my waist was 4 inches larger than before, and so I just kind of went through that same thing again, and so it kind of brings back to the forefront of this wonderful genetic issue. I don't know if you call it a disease or it's just who I am. I mean,
Yeah.
it's. Yeah, I did forget to mention, because I looked down at my leg, and gosh, it was about 2009. I ended up slipping and hitting my leg on my deck, and I thought, well, again, one of those, oh, that was kind of foolish, and elevated my leg, and I went to put my foot down, and the pain was so bad. I mean, it was ended up going into the emergency room, and I ended up having it's called it's like a compression or a compartmentalization of my calf area where the swelling was so extreme that it was pushing on the nerves in my leg, and it just made for just incredible amounts of pain, and it was just and I'm still to this day dealing with issues with that little incident. So
Wow. So let me go back to the internal bleeding from when you did the crunches.
yeah.
Did they ever figure out what exactly is bleeding in there?
Not really. We had went through and had more um, CAT scans, and they looked at the area and figured out, well, you must have just tore your a muscle in your abdomen, um, and that caused the hemorrhaging. I mean, it was just, and that's sort of the challenging thing as far as for me is, they can't quite pinpoint, either um, an artery that's ruptured, or it's hard to identify a muscle that's torn, but
Yeah.
they can kind of tell sort of where the blood is originating from, and so, and as I call it, because when you have that amount of blood volume in an area, a lot of times your body has a hard time kind of flushing it all out, and so to this day, I still have remnants of I don't know if it calcifies or so in your side, and so it makes for sitting to be challenging. I have a stand-up desk at my desk, so that I can get through the day, from just the discomfort of having the remnants of the fluid from the first event back in 2002.
That's incredible. It sounds like you've gotten really lucky.
I've been really lucky. I mean, blessed. I don't know if blessed or how you can describe it. I mean,
Yeah.
it's my first stroke, or hopefully my only stroke, was a few an hour prior. I was 5 miles away from my friends, in the middle of nowhere, and so
Wow.
if it would have occurred then, who knows what the results would have been.
Right.
And and so it's something I'm dealing with, and right now, we're kind of moving forward. We're really lucky to go to the gathering in Seattle, where Dr. Byers and Dr. Shalhoub,
Shalhoub.
put together. This is where you and I met.
Yeah, they're
Um,
amazing.
Met some other people, heard their stories, and the wonderful thing is that like my kids, who haven't been tested, my younger son um, didn't want to get tested. Anyway, with my kids, they didn't want to know, because they got to see what events that I've gone through, and so going to the gathering up in Seattle, my kids both have decided to be tested, because learning that knowing is better than not,
Hmm.
and
How old are they?
um, my youngest son just turned 21,
Hmm.
and next month, my older son will be 23. So,
Wow.
and I'm sorry. This is just.
There's no reason to apologize. It's a very emotional story, and it's a really incredibly daunting thing to have. So your amount of positivity is amazing, and we all have emotional moments, and there's nothing to apologize for there. Just take as much time as you need.
Well, fortunately, I'm blessed with having wonderful kids. My wife has been there every step of the way for me, and her parents are wonderful. My family is my dad's wonderful. Fortunately, when I was diagnosed, my dad was tested, and he, fortunately didn't have, it. My brother was tested, and he fortunately was didn't have it, and my sister decided not to, and my mom, didn't as well, and the interesting thing is that when you kind of look at me and my mother and my grandfather on my mom's side, and we all have a very similar look.
Mm-hmm.
And I've been curious about seeing if she would be, if we could do a test on her as well to see if kind of that is the direction that this genetic substitution came from, or if I'm just the start of it. So
Yeah, and they have talked about the mosaic mutation. They talked a bit about that when we were in Seattle. I think that we think that my mom is probably mosaic. It's where they show a lot of the features, but they don't have it. I think it's like it's almost there,
yeah,
but not quite. Is like my understanding.
yeah, that could very well be. And I'm kind of jumping around a little bit, but it was interesting. Um, I was born in Las Vegas, and my dad was a photographer for Pan Am, where he was taking pictures of all of these nuclear tests and things, and my mom had thought it was because he had been kind of radiated from these tests that her skin kind of changed, as far as her legs and being susceptible to, I don't know if it was freckling or whatever. I always talked about something like that, thinking that it was, but it was like, and I look at, when I'm, in the sun, that my skin kind of does the same thing as hers. And so that might just be a genetic thing, but it's kind of maybe that mosaic transference, or however it's figured out. But
yeah, I'm interested to learn more about that as they do research.
yeah. So anyway, when I started talking about my kids, and they're getting tested in a week, and this has to do with our travels to Seattle, and I really appreciate the people and their stories that they shared, and their the challenges that they were placed in, and it really helped us talk with our kids and identify the importance of being tested, and so that's kind of my story.
So when will they get their test results? Were they both recently tested?
The younger son, he's going to be tested tomorrow, and so it'll be, I'm not sure how long it'll take, if it's 3 or 6 weeks to get the results, and then we'll be working at getting my older son over to the valley to be tested. He's, both of them work, but fortunately, the younger son has day off tomorrow, and the older son, he works most of the week, so it's just working at getting him over to the lab.
Yeah. Well, it's so good that they've decided to get tested because it's so much easier in some ways to know, because if you have an emergency, like you've experienced it, you had a dissection in the woods and a stroke, and then the thing with your lungs, and you didn't know that you had this at that time, and it might have been something that would have been looked at more seriously if it had.
Oh yeah. Well, and when I go into the dentist now, I mean, and with the reaction and the the understanding of keeping my blood pressure low, is that we monitor anything. If I have a need a filling or anything, it's everyone is aware that we need to keep my blood pressure low, and to hopefully prevent any sort of additional issues.
Yeah, yeah, for sure.
Yeah.
That's what makes it so important to be tested.
Yeah.
I'm like a huge proponent of testing because I wasn't tested for 3 years after they told me I didn't have it, you know?
Yeah.
And that's what took it so long to figure out what was wrong with my neck, so it's just amazing. I can't believe I didn't test you after you had the stroke and carotid artery dissection when you were 25.
Yeah.
That's incredible.
Yeah, it's just, and I think at that time it's because they did, you know, need to take the tissue samples, I think, in 1989.
Yeah.
And then took a few years. But yeah, the number of doctors that I went to that kept saying, well, you might, but you really don't look like it. And so,
Yeah, they had the answer. Like, they were right there on the answer.
yeah.
It's amazing.
Yeah, it would be really, I mean, the events that potentially, wouldn't have occurred. But,
Right?
you know,
So what kind of
oh,
things do you do now? What do you like to do? Do you keep physically active at all? What do you
uh,
do?
no, I mean, I try to walk, but, every time I try to do any sort of physical activity, I have something happen. I mean, my wife and I started walking again in town. It's like, well, we'll be on flat ground, so it won't be fine. Well, so, you know, we decided that since my son is one of during the summer is a assistant ranger at one of the parks north of where we live. There's like, I don't know, 20-mile stretch of parks that he takes care of, and
Yeah.
we would go look at what some of the work that he'd been doing, because he helped build this 60-foot expansion bridge and all of these trails and things. And so we walked that, and it was 7 miles, and it wasn't really that physically demanding. And so a couple of days later, I'm standing at my desk at work, and something in my knee, just pops. And it was just like, oh, that really kind of hurt. And I went to step, and my knee was locked, like there was something in my, in my knee that was preventing it from bending.
Mm-hmm.
So, I had to, call my family, finish the work day limping around. It didn't hurt to stand on, but I couldn't bend it, and it hurt to bend. And so I had to call, my son, and my wife came in and got the car, and I rode in the back of his Forerunner to make it home. And 2 days of icing and elevating, and whatever was wrong, popped back into place, and I could bend my knee again. And a week of sitting down, and I was ready to go, again. And so it's just really challenging. I mean, I tried swimming. I was doing reasonably well with that,
Mm-hmm.
but I've dislocated my shoulder so many times that, after swimming for, 5 or 6 months straight, my shoulders would be so sore after just a few laps that I couldn't do that any longer.
Wow.
And so I was just trying to find a balance, and my, doctor's always, going, you need to exercise more, but you can't get your heart rate over 110. And, and then, when I try to do, anything, walking on flat ground or, anything, I just, keep having things that I have to, work at overcoming. And so I think that's, my biggest challenge is overcoming everything.
Yeah.
And finding out what works for me.
Yeah, and let me know what you end up finding out that works for you, because I mean
Yeah.
that's got a huge challenge. It sounds like.
Yeah. Well, and I hope, one of the things that was interesting, and it could have been just the stage of life, people are in, but at the, gathering that we had, I looked at it and I was like the oldest person with, Ehlers, vascular Ehlers Danlos in the room. I was like, I felt like I could be the parents of most of everyone, the patients there.
Yeah.
And, I hope that, for me to, be in, the age I am, that I'm, a positive, reaffirmation that as long as we take care of ourselves and try to stay healthy and everything, that we can have a long life. I mean, it's, you know, you look at the statistics and they say different, but I think it's more of a, because you don't know. And if you do know and you take care of yourself, that you can enjoy yourself, enjoy having wonderful families. I'm blessed with my kids, and I call them kids, but they're adults, and my wife is such a wonderful supporter, and so I really feel that I'm blessed.
Yeah, and it's certainly inspiring to meet you and talk to you, especially there, because you're right. You're one of the older people that I met. I don't know if I've, not to call you old, but
Yeah,
it is inspiring to meet somebody in their 50s with this, because most of the people that I've met are around my age or younger, and some have had more severe complications than I've had yet, and some haven't had any yet, and they're just in the beginnings of their lives. And to meet somebody in their 50s is pretty inspiring.
yeah.
It's hopeful, it gives me hope.
Oh yeah.
Because it's so easy to just sit here and be like, well, might not live too long, but I'm going to live a good life. It's so easy to think that in my 30s something could happen, or, I might not make it to 30 or whatever, so.
Yeah.
Try not to
But
focus on that.
no, it's one of the I when I talk about, I probably drive my kids crazy a lot about the different things that have helped me, and when I was diagnosed with this, it was pretty, takes the wind out of your sails, or at least it did for me, and
Yeah.
and kind of a sort of a little bit of a depression kind of a thing going on, and my doctor in Eugene, he was just really supportive, and we talked about a lot of things, and it kind of helped a little bit, and and I got to mention this because it's just really what helped me. As I was sitting in the movie theater watching a Disney movie called Meet the Robinsons.
Mm-hmm.
And at the very end of it, there was a little letter that was written by Walt Disney, and it had to deal with failure, and because a movie that they did apparently wasn't as successful as they had thought it was going to be.
Mm-hmm.
And he describes that if you just look at that and stop, and you don't learn from it and move forward. From the knowledge that you gained, then it was a failure. But if you keep moving forward from that spot, and so I kind of pulled that, keep moving forward from the date of my diagnosis,
Yeah.
Every day, to be, as positive as I can be. I mean, it's enjoy, everything, love your kids, your wife, people you work with, and try to elevate them and make a difference. I think it makes me a better person. It makes me enjoy life so much more.
I love that. I do. I love that. I've now I'm gonna start getting emotional. No, I love
But
it.
yeah.
Thank you.
So anyway, so this has been wonderful.
Yeah, this has been great. So, thank you again so much for talking to me today, and it was so great to meet you in Seattle.
Great.
Really. So, thank you everybody for listening. This was Staying Connected, and this was Brooke. New episodes are coming out on the last Sunday of every month. Hopefully, one day we'll have more episodes more frequent than that, but for right now, I'm sticking to last Sunday of every month. So, thank you for listening, and we'll talk to you soon.